Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. Okay, we're going to do a little magic trick now, and that trick involves a pair of dice. It's kind of a dicey trick, but what I like to do is show you exactly what kind of magic we can do with a pair of dice. The other thing we're going to use is a deck of cards and a prediction. Now I can roll the dice a few times and we can pick whatever number we like, but let's just roll whatever this next number is going to be, and that's a 6 and a 4, which is 10. Now we're going to take that 10, turn it over, and add the other side. So that's 4. So our prediction is 14. Now, before I go any further, I'm going to predict that the 14th card will be the 7 of hearts. So we'll turn them over 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and the 14th card, 7 of hearts. So how in the world did we do that? To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Okay, before we get to this week's root tip, I want to tell you about a couple of new products that I think you're going to find very exciting. The first one is called MagnaView. You may have noticed that the root tip magic trick of the week was shot with the MagnaView, and it's a close-up system allowing you to see things you've probably never seen before. It's much better than loupes, much better than a microscope, and I'll tell you all about it in an upcoming episode, but I do want you to know that we are working with the MagnaView, and there's some exciting things coming with that. The other thing I want to talk to you about for just a second is a new machine that I'm using to exercise with. It's called the ROM Range of Motion Time Machine. For the last 2 months, I have been exercising every morning for only 4 minutes per day. 4 minutes with the upper body, and the following day 4 minutes with the lower body. I've had amazing results. I'm going to document these for another month or so, and then I will show you about the ROM machine. It's just pure magic. Meanwhile, let's talk to Joe for just a couple of minutes here and let him tell us about the latest in the research department. And so here is a few seconds with Joe. I recently read an article about sodium hypochlorite accidents, and they said in the article that these incidents were very rare indeed, and I thought I would do a little research and see if that's in fact true. I was reading the November 2008 Journal of Endodontics, pages 1346 through 1350, and they talked about how many incidences of sodium hypochlorite accidents actually did occur among a certain group. And what they did was they surveyed 719 diplomates of the American Board of Endodontics, and out of that, 44% or 314 responded to the survey. Looking at the numbers in the article, it says that over half of the 314 diplomates who responded to the survey never had an accident during their entire practice career, which means that half of them did have an accident. The remaining 82 reported just one accident, and 50 reported more than one. And how many people did not even go in with the survey because they had had an incident and they just didn't want to admit it? And how many incidents with sodium hypochlorite are never reported? Anyway, I think it's probably a larger problem than we really anticipate or we really realize. And in a future Root Tip of the Week, we're going to talk about some ways to avoid this entirely so that you don't have to worry about even having one incident. This particular study showed that many more maxillary teeth, especially molars and premolars, were involved with sodium hypochlorite incidents compared with mandibular teeth, which is not unusual. Here's a couple of interesting statistics that came out of the study. They found that the results of case reports in the survey found that maxillary premolar and molar teeth in female patients with a clinical history of necrotic pulp and periapical radiolucency were the ones most prone to experiencing these type of accidents. The sodium hypochlorite accidents may be caused by additional factors other than faulty irrigation techniques, and also And this is probably the best thing. At the bottom of the article it says, the occurrence of an accident by itself did not adversely affect the endodontic prognosis of the involved tooth. So we probably don't have that many incidents out there, and if an incident does occur, it's not a big deal for the most part, but there are ways to avoid it, and we're going to deal with those ways in a future Root Tip of the Week. Meanwhile, this is Joe, and it's been nice talking to you. I'm all done for today. Okay, here's a tip if you ever have to bend an anesthetic needle. This is a 27 gauge needle. Do not use gloved hands because the gloves have impurities that can get on the tip of the needle and contaminate it. Take the cap and bend the needle using the cap at whatever angle you want. And now you will not get impurities. And by the way, exam gloves aren't sterile. And yes, you guessed it, this little segment was filmed with the MagnaView. Well, that's it for another Root Tip of the Week. I'm Dr. Kit Weathers, inviting you to join me at our very next Root Camp. So long for now.